Hello, my name is Hannah Dorton. I will be completing the discussion form in Research and Nursing course examining 5 questions. Question number 1. Why is nursing research essential for nursing practice? When I think about why nursing research is essential for nursing practice, I think about the care I provide to patients throughout a shift. I think about turning a bedbound patient every 2 hours to prevent bed sores. I think about donning gloves to bathe and or change a patient's soiled diaper, gown, and linens. I also find myself thinking about using sterile technique to insert a Foley catheter on a patient to measure intake and output. How do nurses know how to care for patients today? How did nurses know how to care for patients in the past? How will nurses know how to care for patients in the future? Nursing research is essential because it provides evidence on how to care for our patients and it promotes positive patient outcomes. There is so much to learn, and the way to remain educated is to do research. According to our textbook, because the field of healthcare is becoming increasingly more complex and technical, no single individual can know everything about how best to provide safe and effective care. And no single degree can provide the knowledge needed to span an entire career. It is important for all healthcare workers to continue educating themselves and stay up to date on research to provide the best care for patients. Healthcare changes every day, and I believe the way we care for patients today will be different for our patients in the future. Question number 2. What does the future of nursing mean to you? The future of nursing is very important to me. Nursing in the future will not only determine how my family will be cared for, but also your family as well. I think it is important nurses keep in mind the reason they wanted to become a nurse and to realize we are in a field that is constantly changing. The future of nursing also means advancement. I am interested to see the advancement in technology, holistic medicine, and the reach to rural areas. I am from a small community, and it can be difficult to receive high quality health care, see specialists, and even receive education. It will mean so much to me to see these things be available to my loved ones. Through continued advancement in the medical field, I think resources will be easier to access in rural areas as well as all over the world. Question number 3. How can nurse scientist led studies provide information you can use in your daily practice? Nurse scientist led studies can be extremely helpful in any daily practice because of the insight the study can provide. Nurse led studies can have a different approach than a provider or scientist led study based off the experience a nurse has in the career field. Nurses often see things that providers do not during bedside care provided. A nurse scientist led study will be from the perspective of a nurse who has a different view of what the issue is, and they can positively affect the outcome of the study. Question number 4. What gaps do you see in evidence to support nursing care? When I think about gaps that will influence evidence in nursing practice, I think about the increasing cost of healthcare and the willingness to adapt to change. Oftentimes, there is leadership that has continued the same practices for centuries, and they have a large influence on decisions at an institution. With the increasing cost of healthcare, funding can also be the cause for gaps in evidence to support nursing care. I see funding and limited support as an issue to support nursing care. According to an article I found, more specifically, research has found that factors limiting the extent of evidence-based practice include lack of knowledge and skills, insufficient time to find research reports, difficulty in understanding research reports, lack of resources, limited support, lack of financial, material, and human resources, and inadequate training in research methods. Question number 5. How would you identify the role of the graduate prepared nurse in research? As graduate students and eventually graduates, it is crucial we know how to gather and implement research. The research we do today will have an impact and will influence the way we care for our patients. Our research will impact new treatment plans, holistic approach, as well as policy and procedures. I will end this discussion with something I always remind myself. With more education comes more opportunities for me as a nurse to positively affect the outcome for my patients. This concludes the discussion forum in Researching Nursing course examining 5 questions. Thank you.